for National Health Program, an organization of over 24,000 doctors who support Medicare for all. I'm proud to stand before you today voicing our protest of corporate America's ongoing attempt to further hijack and privatize Medicare with their current plan of direct contract entities, also known as DCEs. Others will speak in more detail about these DCEs, but we all need to be aware of the ongoing and unrelenting threat of Wall Street to become the gatekeepers of yours, mine, and everyone else's access to health care in this country. Our decades-long history of healthcare decisions made between a patient and their doctor is becoming a forgotten historical anecdote. We cannot let those healthcare decisions between a patient and their doctor become an artifact only seen in old TV shows and movies. We must stop allowing space in our exam rooms for private equity investors or Wall Street profiteers. As a senior citizen, I chose traditional Medicare, not privatized Medicare Advantage. Traditional Medicare is simple, efficient, and without a middleman. This choice that I made allows me to go to any doctor or hospital that I choose, not one chosen for me by an insurance company, Medicare Advantage, or a managed care organization. However, the plan of private equity in Wall Street for those of us with traditional Medicare is to become transferred to a DCE without our knowledge if our physician becomes affiliated with one. Without our consent, Medicare can search the claims history of those of us on traditional Medicare, find our past visits to our provider who has since become a provider with a DCE, and then use this information to remove us from our chosen traditional Medicare plan to that of a restrictive DCE. Our choice gets taken away from us. We are given the middleman we chose not to have. We need to eliminate this ongoing privatization of our healthcare system that eliminates our ability to choose our providers and hospitals. Currently, the United States ranks the worst among all industrialized countries in almost all parameters, including life expectancy, maternal and infant mortality, and the provision of preventive care. We all benefit when everyone has access to health care, and the only way to do that is to have a system that does not include profit margins or shareholder dividends disguised as a middleman. We cannot allow the ongoing onslaught of privatization with these direct contract entities. Thank you.
Good morning, everyone. Thank you for being here today in front of the headquarters of Health and Human Services, where here in Washington, D.C., where Secretary Becerra lives. The doctors behind me traveled long distances to be here today because they know something is happening here today in this building that must be stopped. My name is Malino. I'm a pediatrician from San Francisco and past president of Physicians for a National Health Program, and I also support a national single-payer healthcare system in the U.S. We are here today on behalf of the 13,000 individuals and physicians who signed a petition demanding an end to direct contracting entities, the latest attempt by CMS and the Center for Medicare and Medicaid Innovation to radically transform Medicare by handing the care of millions of seniors, people with disabilities, and people with end-stage renal disease and others on traditional Medicare without their knowledge or consent to Wall Street investors. Launched in the final days of the Trump administration, the direct contracting pilot model has been green-lighted by the Biden administration to completely privatize Medicare by 2030. There are 53 direct contracting entities that have signed contracts with CMS. They operate in 38 states and DC, and most are owned by Wall Street investors who, like Willie Sutton, that very famous bank robber of the early 20th century, recognize where the money is. This program promises to radically transform Medicare by completely privatizing it by 2030, undermine seniors' choice and agency by auto-enrolling millions of seniors and people with disabilities without their consent or knowledge, incentivize harmful restrictions on patient care. DCEs can pocket up to 40% of the Medicare money for their own administrative fees and profit, lack transparency and accountability. The Innovation Center has the authority to scale up any model that fulfills its criteria to all of Medicare without congressional oversight or approval. CMMI has never had a single hearing in Congress. And as we will hear, incentivize fraudulent upcoding, threaten to bankrupt Medicare, and finally, result in big winners, private insurance companies, Wall Street investors, and big losers, seniors, people with disabilities, taxpayers, and members of Congress who will undoubtedly hear from their constituents asking them why they're doing nothing to stop the radical transformation of Medicare under their watch. If we don't act now, there won't be any Medicare for all left to fight for. Secretary Becerra in this building has the power to stop direct contracting entities. We are here demanding that he stop direct contracting entities now. Thank you.
Hi, my name is Dr. Ed Weisbart. I'm a family physician from St. Louis, Missouri, and I'm a board member of Physicians for a National Health Program. I traveled here today because I am alarmed about direct contracting. I'm alarmed because it's designed to get in the way of my patients' health care. For example, I'll tell you about a patient of mine whom I'll call John. He died recently at age 65 of esophageal cancer. This is one of the cancers where you can't waste any time. Any delay lowers your chance of survival. John's cancer showed up 6 months before he turned 65, and his insurance company wouldn't pay for him to go to the surgeon who we knew was the most experienced at this. When John turned 65 and got into Medicare, he immediately went to see that surgeon, but by then any possibility of a cure had passed. When you're healthy, this all seems like somebody else's problems, but when you're in John's situation, the very last thing you want is a for-profit middleman like these new DCEs showing up to manage your care. These new companies have strong business imperatives to get in your way, just as John's insurance company did to him. DCEs are designed to introduce problems like John's across all of traditional Medicare. I want to explain that so you can see how DCEs threaten both our seniors and the very future of Medicare itself. Ever since Medicare announced that direct contracting pilot program, Wall Street investors have been flooding in, buying up physician practices or spinning off shell companies to become direct contracting entities. Why is this so attractive to Wall Street investors? The potential benefits from owning a direct contracting entity are nearly endless. I want to describe two of the ways that this works. First, Medicare pays DCEs more money for sicker patients, but that gives DCEs a strong incentive to engage in a type of fraud called upcoding, which means exaggerating or even falsifying seniors' diagnoses to make them look sicker than they really are. Several new industries are springing up to maximize this upcoding. Artificial intelligence tools, machine learning software, astonishing financial incentives for physicians like me, and even home care companies that provide no real care other than incessantly searching for new codable diagnoses. One such company promotes itself to its investors by claiming it'll drive an 81% increase in net new diagnoses and care plans. I don't know any physician who finds these tools improve patient care, but Wall Street just loves them because upcoding can earn DCEs thousands of extra dollars per senior per year, and that's money that they don't actually have to spend on health care. This is how DCEs compete. They compete on their ability to upcode, not on their ability to improve our health. Second, DCEs are paid a lump sum per senior and are allowed to keep as profit and overhead what they don't pay in health services. This creates a dangerous financial incentive to restrict care, as the as happened to my friend John, my patient John. Former CMS Administrator Dr. Don Berwick and former CMS Innovation Center Director Dr. Will Gilfillan estimate that DCEs may spend as little as 60% of their Medicare payments on actual health care and keep 40% for themselves as overhead and profit. That's 40 cents of every Medicare dollar staying in their pockets. To put that in perspective, traditional Medicare operates with a 2% overhead, spending 98% of their money on actual health care. Spending $1 in DCE to get maybe 60 cents of care is a pretty lousy deal, but that's exactly the deal in direct contracting. I reject that deal. I want to protect traditional Medicare, and that's why I'm here today.
Yes.
Hello everyone, thank you for attending. My name is Edward C. I'm a second-year medical student and a member of Students for a National Health Program. I remember a long time ago when I was a Boy Scout and I had to recite the Scout Oath, which pledged, among many other things, to help other people at all times. Those few words, along with my own family's experience with large bills and our reluctance to seek care when our coverage ended, have played a tremendous role in not only me wanting to become a physician, but also to support a more moral system such as Medicare for all. In such a system, I would be able to see my patients and treat them based on medical need, not their financial status. In our current system, not only can I not do that, because healthcare is oftentimes financially inaccessible even to those who are insured. And I can't even live by the physician's creed to do no harm, because oftentimes our system financially harms people again and again. Quite frankly, I dread the day in which I become a physician and I may have to abandon my patients for reasons that are beyond my control or the patient's control. So I stand here today because I want to tell, essentially because I want to take back my future profession from the third-party middlemen who do things like upcoding fraud, cost inflation, denying care at the detriment to me and my patients. And quite frankly, our health of our nation and our communities are at stake, and I'm not willing to sacrifice that for the greed of a few. Okay? Did you know that the maternal mortality rate in this country has been increasing while it's been decreasing in peer nations? We have the opportunity to improve the health of our nation, but that's only if we consistently do the right thing. And I'm calling on our legislators, President Biden and HHS Secretary Becerra, to do the right thing. And right now what that is to stop the privatization of Medicare, to keep Medicare prosperous for our seniors, and eventually improve and expand upon it so that it will be prosperous for all, including my future patients. Thank you.
Well, good morning, and thank you all for coming and for watching this live stream. My name is Judy A, and I'm an obstetrician gynecologist from Pittsburgh and also a national board member of PNHP. I would like to talk a little bit about how the direct contracting program could have arrived so quietly, because you are not alone if you haven't heard about it. Most seniors and doctors and members of Congress have never heard of it either. Well, how could this be? That's a very good question, and perhaps a little background could help us understand that. Direct contracting was unveiled under the Trump administration in late 2020 by the Innovation Center at the Centers for Medicare and Medicaid. the Innovation Center was actually authorized under the ACA and given the task of designing and testing new payment models. The Innovation Center looks for payment models that could lower spending for Medicare and Medicaid while maintaining or improving the quality of patient care. However, it can be very difficult to find accurate information on the models and how well they actually work. So there is a bit of a transparency problem. More importantly, Innovation Center programs that are judged successful may be expanded into the full Medicare program without congressional hearings or approval. This means that direct contracting entities could cover 30 million Medicare beneficiaries who did not choose to be enrolled in a middleman program, and also without any input from our congressional representation. This is truly a radical transformation. So why haven't we heard about direct contracting? Well, it is very complex and it's extremely hard to explain. There has been very little coverage in the mainstream media, allowing the program to fly under the radar. In contrast, we are flooded with a multi-million-dollar ad campaign for Medicare Advantage, further confusing the public. But we are here today to show that when we take the time to understand what's going on and share it with the public, people will take action. We have signatures here from 1,500 physicians who agree that direct contracting must be stopped, and more than 10,000 additional citizens agreed and signed the petition once the light was shown on direct contracting. We've had a lot of help. We are grateful to Social Security Works for providing this wonderful live stream, and for Diane Archer's advocacy through Just Care, and finally for the work of Public Citizen in showing this information. Together, we will continue to raise the alarm until we stop this threat to Medicare. Thank you.
Yes.
Hello everyone, my name is Melinda St. Louis and I am the Director of Public Citizen's Medicare for All program. Public Citizen is proud to be standing alongside the thousands of doctors that are part of Physicians for a National Health program in calling for Medicare to stay public and to stay prosperous for all. Yeah. We have been more than 5,000 of our members signed this petition alongside the PNHP physicians, and the petition specifically calls on Secretary Becerra to keep Medicare public and nonprofit for current beneficiaries and for generations to come. Medicare, as we know, has been a lifeline for older Americans, and it's overwhelmingly popular and much more efficient and cost-effective than private insurance plans and Medicare Advantage plans. This direct contracting experiment could lead CMS to auto-assign as many as 31 million people involuntarily to a Medicare Advantage type health plan that they specifically opted not to join when they signed up for traditional Medicare. This is an unacceptable bait and switch that presents real threats to people enrolled and to the Medicare program overall. With private insurers and the for-profit investors in the program, maximizing revenues, not quality of care, will become the central focus. And that is the problem with our current broken, expensive, and cruel healthcare system. And we know, and Secretary Becerra knows, that the solution is to move toward a fully public single-payer healthcare system. And this CMS direct contracting experiment takes us in the absolutely wrong direction. So we join the physicians around the country in demanding that the DCE program be stopped immediately. Thank you very much.
Good morning, everyone. I'm Dr. Claire Cohen. I'm a child psychiatrist from Pittsburgh, Pennsylvania. We are here today with several demands. First, we have the signatures of over 13,000 people, including 1,500 physicians, who agree that Medicare direct contracting must be stopped. We're calling on President Biden and Health and Human Services Secretary Xavier Becerra to end the Medicare direct contracting program immediately. Stop enrolling seniors immediately. Stop accepting applications for companies to become direct contracting middlemen immediately. We know you can do this because you already have stopped one segment of the Medicare Direct Contracting program called Geographic Direct Contracting earlier this year when you took office. Now it's time to finish the job.
Now.
After we leave here, we're going across the way to meet with members of Congress, many of whom don't even know that Medicare Direct Contracting is happening. We're going to educate them and ask them to help us fight against this radical transformation of Medicare. We're also going to ask them to hold a hearing in Congress so that every American can fully understand what direct contracting is and how it threatens traditional Medicare. No more secrets. For those of you watching this on live stream across the country, here's what you can do. First, share this video and our petition on your social media channels. Make sure your friends, neighbors, and colleagues know about Medicare Direct Contracting and how we can fight back. Next, go to pnhp.org/stop-DCEs. That's capital D, capital C, capital E, S for plural. Go to pnhp.org/stop-DCEs for a link to the petition, fact sheet, and other resources. And since today is Giving Tuesday, help us fight against the commercialization of Medicare by making a donation to Physicians for a National Health Program. Together, we can fight to not only preserve and strengthen Medicare, but expand it and improve it to everyone in the nation with single-payer Medicare for all. Finally, our delegation is going to deliver these petitions, all 13,000 of them, to Secretary Becerra. And if you're watching at home, please call his office now at, you have the phone number right over here, 202, hold it high so we can see, 202, 205, 5445. Call him as soon as you can, telling him you want him to stop DCEs, Medicare DCEs now. Together, we can protect Medicare for today's seniors and for future generations. Thank you.
Yeah. Give it to him, doctor.
All right, so now our speakers are going to go into the building and drop off. Thank you, everybody.